this edition of 4x4, I had the privilege of speaking with Ken Haynes, president of Advocate Health's Southeast region. Ken has over 30 years of experience across the continuum of healthcare. His most recent achievement includes helping to oversee the merger of two health systems, which now combined encompasses more than 1,000 sites of care, 67 hospitals, and more than 151,000 teammates. We spoke in Ken's office in Uptown Charlotte, where he offered his insights on the blueprint for a successful merger of any size, excelling in a highly regulated field, and how AI and ChatGPT impact the healthcare industry. All right, question one. At the end of 2022, Atrium Health and Advocate Aurora Health combined into one organization called Advocate Health. Your new organization now comprises of more than 1,000 sites of care, 67 hospitals, and more than 151,000 teammates. That is a massive undertaking. What do you think is a blueprint for a CEO contemplating a merger or acquisition of any size to ensure a successful outcome?
Great question. I'm exhausted just hearing you read those things, but we're really excited about bringing our two organizations together because we believe Advocate Health is going to really be able to impact our communities in a big, big way. It puts us as the third largest not-for-profit in the United States. And when we went into it, we always asked the question, is it going to make our communities better? And if we don't believe that wholeheartedly, we don't even go past go. And then, clearly we had to have cultures aligned. And in our situation, two mission-based organizations that are quite successful in their own right, it was easy to see those cultures blending well. And so that's always important for us. And, we want to make sure our teammates feel good about why we're doing it, and we always tie it back to our mission. So, the thoughts for us as an organization is together, can we do things better, faster, and do more for our communities?
All right, question two. Just like financial services, the healthcare industry is a highly regulated field. How do you navigate issues like an aging patient population, fierce industry competition, and financial pressures while recruiting and retaining top talent and addressing health inequities that the pandemic has exacerbated?
Well, a lot in there. I think the key things you ask about are, dealing with regulation. It is a regulated environment, but the core is the second part of what you talked about, and that's the teammates. That's the people. It's a people business. It's people taking care of people. So our teammates are critically important to us, and so we need to make sure we're doing right by them, and we always want to make sure we're doing right by our patients, and ultimately that impacts the impact to the community. So, right now it is an absolute talent war in all industries, and so we're not immune to that. In fact, the pandemic probably pushed our industry even more. We're blessed as an organization here in Charlotte to be able to attract a lot of great teammates. So our talent war, we're winning, but it's very difficult because there's a shortage of many of these high-tech or sophisticated caregiver components. So we're building that, to be honest with you. We're going upstream and we're creating new opportunities for people, minorities, people that haven't impacted healthcare or had the opportunity. We're going to ninth grade, bringing them in and letting them see what we do because it's an impactful career and we need more people doing it.
All right, question three. AI and ChatGPT are all the talk right now. How does Advocate Health currently integrate these and other telemedicine practices? And what is the positive long-term impact of the digitally enabled care?
Well, great question and timely for sure. We've been an early adopter in the telemedicine area because we know that there's a shortage of physicians nationally, and anything we can do to multiply those scarce resources, the better. So we've been an adopter of that, and really the key is the clinician, whether it be a physician or an APP, providing that care directly to the patient. And we are a strong believer in care closer to home. And so this telemedicine component allows us to actually go into the homes and provide that care. When we had bed shortages during our pandemic, we took the hospital at home area, used the technology so we could actually, find out where those patients were and then take the care to them. So, and it kept our hospitals from being overcrowded during that time. We just think it's a key part of being more efficient for our community and for our patients.
In January, Advocate Health broke ground on the Wake Forest University School of Medicine, Charlotte, in Charlotte's new innovative district, the Pearl. What entrepreneurial opportunities are created at this intersection of health, academia, and innovation? And how do you think it benefits the people who live and work in this community?
Well, we're incredibly excited about the Pearl. It really is an opportunity for us to take these outstanding caregivers doing great care for our community and bring in national resources to find the next level of healthcare. And that's what the Pearl will be about. And, the other beauty of it is we made sure it impacted our entire community, albeit it'll be sitting out here in the Pearl as a district. We're making sure folks from all walks of life come in and work and are able to participate in this. Many of the jobs that are created are non-4-year degree jobs, again, so we can have a diverse population that's actually participating in the Pearl. We do believe it'll allow us to find those breakthroughs. We've got many Fortune 500 medical firms that are already signed up and coming. Siemens has been communicated, several are still to be communicated here pretty soon. ERCAT is a place where we simulate surgical work from all over the world, and they have multi-sites throughout the world. So we're really proud of the fact that we will have all of the diverse components of care and our community providing that work behind the Pearl. So it'll be the crowning jewel for the Queen City, we think. So
let me go ahead and, if it's okay with you, ask you a bonus question.
Sure.
I know you're a sports guy. I know you went to Alabama.
Right.
I heard they're pretty good at some sports. What do you think probably the most heartbreaking home loss that you've ever experienced as an Alabama grad? And who was it to, and what year was it?
I think it had to be with Joe Burrows when he came into Tuscaloosa and took care of business. 4 years ago or so? Turned out to be a pretty good quarterback, though. It's just in the NFL. But now let's get to the good stuff. Bryce is going to do it. Just get ready.
Yeah, Bryce Young?
He is going to do it. Yeah.
Well, Ken, thank you so much for your time. Appreciate you being a generous host.
Fantastic.
Love the office here. Love the people we've met, and we appreciate the kindness that you've showed us.
Fantastic. Thanks for letting me tell a little bit of the story. We're excited.
Thank you, sir.
You bet.